Hello, I'm Dr. Guru. I am a consultant psychiatrist currently practicing in UK. I made this short 2 minutes video. This is an awareness video on the topic PTSD. I'm hoping anyone who's listening to this can identify what PTSD means, what are the signs and the symptoms to look for, what are the things that a person might experience, and lastly, I'm going to talk about what are the treatment and help that are available. Okay, so first of all, let me start with the topic PTSD. PTSD, in a simple term, means, or the full form is post-traumatic stress disorder. It is a mental health condition that is caused by extreme stressful or terrifying event, either being a part of it or witnessing it. Okay, so that's the definition of post-traumatic stress disorder. Now, anyone who experiences this traumatic events, which could be a war kind of situation, and the traumatic events, it depends from individual to individual. So it's very difficult to define a traumatic event for one person might be different to another. Okay, so the stages the people go through in the traumatic event is: number one, they have got this stage of impact or emerging stage. Number two, there's a sense of denial and numbing stage. Number third, there's a thought of intrusive and repetitive stage of where this thought keep on coming. Fourth is they feel a sense of short-term recovery, which also tends to impact the memory of an event. The last part is a long term. If it is not resolved, it causes long-term reconstruction of the mental health problem, or it also impacts the mental health in a longer way. Four of the main symptoms that you can see in post-traumatic disorder is: number one, there's an intrusive thought, the thought that keeps on coming. Even if you try to resist, it becomes more painful and stressful. Number two is avoidance. Avoidance means that the situation or anything that remind of this event, people tend to avoid those kind of situation. It can even be like a news. It can be even a thing that remind them of that event. Number three is you get flashbacks. Flashbacks are like you cannot get you cannot remember the full events, but flashes of the event that might be very stressful. Number two, you become hypervigilant. Hypervigilant means at least you are in the stage where you feel that the event is going to happen, and it might impact your day-to-day normal day function. Okay, so this is what you encounter in PTSD. In PTSD, have to remember it. The four stages you go through: fight, flight, you tend to freeze, and you tend to re-encounter those events. Now, anyone who is experiencing PTSD, keep in mind there are some help you can seek. Okay, so as a consultant psychiatrist, I would highly recommend, if you guys are experiencing any PTSD, there's a help. Please do seek medical help, especially psychiatrist and psychology. So the treatment for PTSD currently, as per the NICE guidelines that we follow in UK, psychology, medication, or you need to use combination of both. In terms of the recommended talking therapy that is currently in that we recommend are traumatic cognitive behavior therapy, and the second one is called EMDR, that is rapid movement desensitization reciprocating. So these are the talking therapy that can help you to understand your trauma, help you to cope with it. Okay, and the sessions, it's not going to happen in one session. It might take 12 to 16 sessions, one session per week. Currently, there are also supported traumatic focused computerized CBT. This is a talking therapy. The second option is there is also a medication called SSRI, which we tend to recommend in people having PTSD. Keep in mind, people having PTSD can also have other mental health conditions like depression, anxiety, which needs to be addressed properly. So in summary, in this 5 minutes, what I have gone through is I've gone through what PTSD means. Number two, what are the stages that the patient might go. Number three is I've also briefly discussed about what are the signs and the symptoms to look for. And number four, I've covered the treatment, which caters talking therapy and medication. Thank you very much. I hope people who listen to it might get an idea about PTSD, and I would highly encourage to seek appropriate help for PTSD. Okay, and before I end this session, I have to tell that PTSD might be seen in the first few weeks of a traumatic events, or it can be even seen in long term. Keep in mind, if PTSD is not treated at the right time, it can impact someone's life in a big way. Thank you very much. Take care.